Have you ever had a sudden jolt of pain in your leg, maybe while walking or even while resting, and wondered, what just happened? That intense involuntary tightening of a muscle is what we call a muscle cramp. And if you've ever experienced one, you know just how disruptive and painful they can be. But here's something you might not know. Not all cramps are the same. In today's episode of Healthwise Living, we're going to talk about the different types of muscle cramps, why they happen, how to tell them apart, and what to do when they strike. Whether you suffer from cramps at night while exercising or completely out of nowhere, this episode will help you understand what's happening and how to respond effectively. Let's start with the most common and most frustrating type. 1. Sudden involuntary muscle cramps, aka true cramps. These are the classic cramps that hit without warning. You could be sitting at your desk, walking across the room, or even just stretching, and suddenly your calf, thigh, or foot tightens up like a vice. The pain is often sharp, the muscle becomes hard, and you're stuck waiting it out. What causes it? Usually, true cramps are triggered by overexcited nerves. This can happen because of dehydration, low electrolytes, or even stress on the muscle from standing, walking, or sitting too long. You'll often see this type of cramp in your calf or foot, and it tends to last from a few seconds to several minutes. Afterward, the area may feel sore or bruised, even though there's no visible injury. How to deal with it? Try slowly stretching the muscle, massaging the area, or walking gently to ease the contraction. Drinking water with electrolytes can help, especially if dehydration is a factor. Now let's move on to a specific kind of cramp that really disrupts people's lives, especially older adults. 2. Nocturnal leg cramps. These are cramps that occur at night, often when you're fast asleep. You might be deep in sleep when you're suddenly awakened by a stabbing pain in your calf or foot. It's not only painful, it's terrifying, especially if you're alone or prone to falls. Why do they happen at night? Researchers still aren't 100% sure, but it's believed that sleeping with your legs in certain positions, like toes pointing downward, can shorten the calf muscles and make them more likely to contract. Other risk factors include poor circulation, mineral deficiencies, and nerve dysfunction. Older adults are more likely to experience these. In fact, over 1% of people over age C report having nocturnal leg cramps at least once a week. What to do when it strikes? The fastest relief usually comes from flexing your foot upwards, toward your shin, standing and walking if possible, or applying warm compresses. Staying hydrated, stretching your legs before bed, and correcting mineral imbalances, especially magnesium, can also reduce their frequency. Now for the third type. 3. Exercise-associated muscle cramps. These are the cramps that show up during or after physical activity. Whether you're out for a jog, working in the garden, or lifting something heavy, these cramps can strike mid-motion and leave you hobbling. They're most commonly seen in athletes, but anyone who's active, especially in hot weather, can get them. The causes? A combination of muscle fatigue, heat, and fluid loss is usually to blame. When you sweat, you lose not just water, but also sodium, potassium, magnesium, and calcium, all of which are crucial for normal muscle function. If you don't replenish these minerals, your muscles may contract uncontrollably. What does it feel like? Usually, the cramp starts gradually, maybe a twitch or a tightening, and then locks up into a full-blown spasm. It can affect the hamstrings, calves, or feet most commonly. Prevention and treatment: stretch before and after exercise. Hydrate during your workouts and consider drinks that replace electrolytes, not just plain water. If a cramp strikes mid-exercise, stop, gently stretch and massage the area, and wait until the pain subsides before continuing. Now let's talk about something very important that people often overlook. Identifying the type of cramp you're having. The key to treating a cramp effectively is knowing what kind it is. Ask yourself, did it happen at rest or during movement? Was I sleeping or awake? Am I dehydrated or taking medications that affect minerals? Was the muscle already tired or sore before the cramp? For example, a cramp during sleep, likely nocturnal. Think magnesium or poor sleep posture. A cramp during exercise, likely activity-related. Think dehydration or mineral loss. A cramp in the middle of the day while sitting could be a sudden nerve-related cramp, possibly triggered by poor circulation or posture. Also, don't ignore frequency. If cramps are happening daily, waking you up at night, or interfering with daily life, it may be a sign of a deeper health condition like diabetes, nerve damage, or side effects from medications. 5. Quick relief techniques for all types. No matter the cause, here are some immediate relief strategies that are safe and science-backed. Gently stretch the muscle and hold the stretch for at least 20 bars or 30 seconds. Apply a warm towel or a heating pad. Hydrate with electrolyte-rich fluids. Massage the cramping area with firm but gentle pressure. Walk around slowly, if you can, to help relax the muscle. For prevention, try doing light calf stretches before bed, drink enough water throughout the day, and talk to your doctor about checking your magnesium, potassium, or calcium levels, especially if you're over 40. Before we wrap up, here's a quick preview of the next episode. We're going to show you exactly what to do when a cramp strikes in real time. We'll walk you through simple, safe stretching techniques you can use during an active cramp to relieve the pain faster and prevent muscle damage. These are evidence-based methods used by physical therapists and doctors to reduce pain and restore mobility, especially in the calves, thighs, and feet. If you've ever felt helpless when a cramp hits, this next episode will give you the confidence to respond the right way, so don't miss it. Subscribe now and turn on notifications so you're the first to see it. And remember, this video is for educational purposes only. It is not medical advice. Always consult with your doctor before starting any new treatment, especially if you have underlying health conditions. Thanks again for watching. Stay strong, stay informed, and as always, live wisely. This content is for informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified health provider with any questions you may have regarding a medical condition.